Okay, so let's get started. This presentation is on cirrhosis. It's a case study. So let's get started. So here's our case study. We have a 72-year-old male by the name of Mr. P. He came in last night with a complaint of abdominal pain, diagnosed with exacerbation of cirrhosis symptoms. Pertinent medical history includes alcohol use disorder for 45 years, AFib, GERD, he's a smoker, and a BMI of 36. Upon assessment, his skin is pale, slightly yellow, complaints of itchiness. His abdomen has ascites. His extremities are 3+ pitting edema bilaterally in the ankles, and his pain is rated 6 out of 10 in the abdomen. Okay, so let's get started on what cirrhosis is. Our liver is made up of many different cells. These cells store vitamin A, create tissue lining, fight infectious material. When these cells are exposed to inflammatory processes, they create scarring on the liver. And over time, with chronic problems and liver injury, these cells fail to work properly. So when the liver does not work properly, the liver gets rid of toxins. Okay, so if this person were drinking a lot of alcohol, aka toxins, that's putting a lot of extra work on the liver, and it's going to trigger a lot of inflammation. So someone like Mr. P, our patient here, is drinking alcohol in excess every day for 45 years. His liver is going to be extremely inflamed, and alcohol is the most common reason for cirrhosis, but other inflammatory processes can be viral hepatitis or metabolic disorders. All these have in common is that they cause inflammatory processes on the liver. So, as you can see here, there's hepatocytes, sinusoidal endothelial cells, Kupffer cells. The damage leads to the inflammatory processes, and the cells deposit collagen, creating fibrosis or scar tissue. That scar tissue makes it extremely difficult to get proper blood flow, and then therefore cause the liver to be unable to work properly. So how does it develop? So when we think of cirrhosis, we want to think of injury. That liver is becoming injured over and over again, and it cannot perform its functions properly anymore. So the number one cause, as I've said, is alcohol use. In alcoholics, the stages we may see will be first fatty liver deposits due to the alterations in the metabolism function of the liver from inflammation. Next will come inflammation. Then after that inflammation, scar tissue is going to be formed, and eventually, when enough of that scar tissue is formed throughout the liver will be unable to do its job, which we refer to as failure. So non-alcoholic liver cirrhosis goes through those same steps and processes. It could be from viral hepatitis or metabolic syndrome, which can be classified as obesity, overweight, fatty diet, diabetes type 2, high LDL, cholesterol. So when you have a patient, you want to gather extensive history and find out, why they have the liver disorder. So let's talk about what we'll see when we have a patient with cirrhosis. They may be asymptomatic for the longest time. They might not notice the symptoms, or just have no symptoms. They're going to have ascites, or that fluid accumulation in the abdomen, abdominal pain, enlarged liver, nausea, vomiting, anorexia, jaundice, fever, altered LOC. So, as nurses, you want to perform a thorough assessment, monitor fluid accumulation, administer prescribed diuretics, collaborate with the physician for possible paracentesis to get rid of that fluid, monitor for complications from portal hypotension. We'll talk about that a little bit later. And educate, obviously, the patient on alcohol cessation. Okay, so as far as labs, you're going to see elevated liver function tests. And then don't want to forget about that pruritus or the skin itching. So in order to remember the signs of cirrhosis, I came up with this. So we're talking about Mr. P, so I called it Mr. P and the P's. So I'll say 1, 2, 3, 4, 5, 6 P's. Mr. P and the 6 P's. So you're going to have that pruritus or itchy skin, the pot belly like the pig, which is the ascites, portal hypertension, plump organs. You can have enlarged spleen and liver. Perplexed, which is a state of confusion. You're going to have that altered level of consciousness. And I couldn't figure out for the beginning, but it's the middle. So Simpsons, because the Simpsons have yellow skin due to that jaundice. Okay, so for treatment, at first we're going to want to treat the symptoms. So diuretics to get rid of that extra fluid. We're going to use antihypertensive possibly to prevent damage to the heart and kidneys from that portal hypertension. Paracentesis, as we talked about, for the fluid third spacing. Then to treat the cause, you want to educate on drinking cessation, or maybe they're complete failure. They need information on liver transplants. Complications, the most dangerous complication is that portal hypertension. So you have possibility to get high blood pressure through the highly vascularized liver, and it's going to increase pressure within the GI tract. So the blood is going to find new ways to get back to the heart through much smaller vessels, stretching and loosening them. These vessels can then burst from the pressure, causing bleeding. So as a nurse, you want to look out for signs of bleeding, either upper GI or lower GI. Upper GI, you might have vomiting, blood, bleeding in the gums. Lower GI, you're going to have that melena or that dark stool. So let's move on. Age considerations, most common is 45 to 54-year-old male. Alcohol abuse. Some older adult considerations, nutrition status, weakness, so they're going to be a fall risk, increased fall risk, urinary incontinence. You want to make sure of that skin integrity due to they're going to already have that nutritional status. They're going to have low albumin, which is putting them at more risk for skin pressure ulcers. Older adults have a polypharmacy, so you want to do medication reconciliation, especially if they're going home with new medications. Chronic conditions, a lot of older adults have chronic conditions, so this is going to be another comorbidity, and you want to be able to collaborate and work with all of their chronic conditions and make sure that they're getting cared for properly. Also psychosocial, you want to make sure that they're not depressed and they have people in their life. A lot of times older adults don't have a lot of family and they may live alone, so you want to address all of those and take those into consideration. As far as culturally, being culturally competent means to be aware of and responsive to patients' cultural perspectives and backgrounds. So you want to take into consideration their values, their traditions, their language, their socio and economic conditions also. So you want to be able to provide respectful care and really get them involved in their own care. That's being culturally competent as well. You want to be mindful of your own bias or implicit bias in regards to the patient's racial or ethnic group. So that way you're not placing your own beliefs onto them when you're caring for them. You also want to demonstrate cultural humility, which involves entering a relationship with another person with the intention of honoring their beliefs, customs, and values, and entails an ongoing process of self-exploration. So you want to be able to be open to learn from this client, not only teach them. Another consideration is the LGBTQIA culture. So as cultures evolve, new considerations need to be adopted. So in this day and age, it's essential for an RN to stay up to date on new cultural considerations, asking preferred pronouns when you think it's appropriate, and identifying certain risk factors for certain patients in regards to like LGBT. So you just want to be aware of all those considerations. As far as home medication, for example, the patient with liver cirrhosis may be sent home with Lasix, which is a loop diuretic and antihypertensive. It inhibits sodium and chloride reabsorption in the distal loop of Henle in the kidneys. And adverse effects: headache, weakness, autotoxicity, palpitations, dehydrations, hypokalemia. So you want them to store the tablets in the container they came in, take only as prescribed, call the doctor if you have ringing in the ears, severe abdominal pain, or sore throat and fever. So that is it on this presentation. Here are the references, and I hope you enjoyed. Thank you for watching.